Welcome to Cancer Choices and Knowing Your Options. I'm your host, Larice Crumley, and today we have a wonderful opportunity of Dr. Gerber, Beth Carpenter, and Dr. Forsythe here to discuss the options of cancer and the different ways we've all come to this as a topic that's close to our hearts. And Beth, I was wondering, you've come here all the way from Austin.
True.
I was wondering if you could share who you are, where you come from, but how you came to know cancer as an intimate topic in your life.
Right. I currently work as a medical intuitive, a spiritual counselor, and a nutritional counselor in Austin, Texas. And I do a lot of public speaking around the globe, actually. I came to know cancer very intimately at the very young age of 23 when I was diagnosed with fourth-stage lymphoma and was given less than 6 months to live. Which obviously didn't occur since I turned 40 this year. But I did use traditional medicine and alternative medicine, and then worked using it complementary. In the beginning was the initial surgery for the biopsy, and then after that I refused further medical attention and chose alternative medicine in healing using diet and color and sound and energy healing, and there wasn't much I didn't try. And then after a number of years I relapsed, and it was during this opportunity I had a chance to look at the core beliefs that were really lodged in there that brought about the relapse. And it was at that time I met Dr. Forsythe and then began using traditional medicine to help regain my health, as well as combining what I knew with what he knew. And then in 1992 underwent a bone marrow transplant, and then once again worked on putting myself back up on my feet again afterwards with the knowledge that I had as well. And I've currently written a book and I am touring. There's a pin on the book cover there, Larice.
Yeah.
Thank you so much.
Yes, I started reading it last
Strength
night.
of the Spirit.
Yeah.
And what I found is people who don't even have cancer have called or written in and said how much this has made a difference in their life.
Yeah.
Yeah.
Well, what I appreciated the chapter that I read is you discuss the things that are often not discussed in our medical offices, of like what it's like to have your relationships end while you're in crisis, saving your life. And so that there's so many aspects that a disease touches, that we all need so much support. And so I found it very informative so far, and I'm really enjoying reading it.
Good, thank you.
Yeah. So Dr. Gerber, you're a medical doctor and you've studied homeopathy. What led you into this, and what is it that you and your clinic do to offer opportunities for cancer?
Well, we don't treat cancer per se. We like to treat people and their immune systems, and I leave it to Dr. Forsythe to really go after the tumors with chemotherapy and such. But the body can do wonderful things on its own, and we're trying to remove as many impediments to the body's ability to deal with, first of all, prevention. Stay out ahead, don't get cancer in the first place, take your nutrients and lead a reasonable lifestyle and try to take your antioxidants and protect yourself from cancer. But ever since my training in internal medicine, pharmacology, and I've been in alternative medicine for over 25 years, that since cancer is going to overtake heart disease as the #1 killer within at least the next 5 to 10 years, it's pretty hard to not deal with cancer in your day-to-day practice, and especially in building the immune system. So we like to look at nurturing and building up people, and detoxification, taking out the bad stuff. And the bad stuff includes heavy metals, and we find people have a lot of mercury and lead in their system. And we try to get rid of pesticides and improve their immune system with nutrients. And then we'd really like to work hand in hand, especially with oncologists like Dr. Forsythe, who is also a homeopathic doctor, to, if people do require more extensive surgery, radiation, chemotherapy, to protect them with heavier duty intravenous nutrients, especially vitamin C in very high dosages, that protect against some of the side effects and improve how people do with cancer. And actually, help kill more cancer cells. So we look at it primarily as an adjunctive service, and we're trying to look at ways of detoxification. And usually when people are in this kind of condition, their hormonal status goes down. We like to help support thyroid and adrenal, and we're very much into natural female hormone replacement, especially progesterone, which can really protect women from getting breast cancer in the first place.
Wow.
And these types of things. We also like to look at musculoskeletal issues and psychological issues of guilt and old psychological and physical trauma that people are carrying around that really suppress their immune system. So there's quite a large number of ways of working with folks to strengthen them in general, either to prevent cancer or to work with them during the process to give them greater hope and greater strength.
Oh, that's so marvelous. That is so marvelous. Well, Dr. Forsythe, this is my first opportunity of meeting you, and I'm so glad you're here. I understand you're one of, like, there's less than 5 oncologists in the United States that have gone into homeopathy. And so that's a very unique thing to go from traditional medicine and then embrace the bigger picture of homeopathy. What made you go that direction?
Well, it came about fairly accidentally and serendipitously. It was basically because I was seeing a lot of the good results that alternative doctors in this area, such as Dr. Gerber, Dr. Allison before her, Dr. Brody in the past, and others who were treating cancer with alternative medicines exclusively. And because I was needed at times to hospitalize patients and to give conventional therapies, I was amazed over the years in seeing how well these patients were doing. And it really collapsed some of my belief system because I was very traditionally trained at the University of California in San Francisco, a very traditional school where over 4 years we had only probably less than 6 hours on nutrition, vitamins, herbs. Never heard the word naturopathy or homeopathy, I think once during medical school. Never really learned anything about the body's ability to self-heal and the powers of the immune system. So this was all new to me, and it was like a bright light shining beyond the tunnel. And over the years, I have gradually tried to incorporate some of the natural therapies and alternative therapies in my own practice. And at this point, I am involved in 2 clinics, the Century Wellness Center, which is a separate, totally homeopathic clinic in which we, like Dr. Gerber, look at the immune system, we look at chronic viral illnesses, we look at chemical toxicities, we look at chronic allergies such as inhalant and food allergies. We determine through various diagnostic tests that aren't really used in conventional medicine, such as kinesiology, dark field studies, electrodermal testing, and through extensive laboratory testing, serologies, viral studies, chemical toxicity studies on lymphocytes. We look at what's impeding and impacting the immune system in an adverse fashion, and through those studies are able to then develop a homeopathic program that is beneficial to the immune system. And so that's what's done at my alternative clinic. In my conventional clinic, I do use some alternative homeopathy therapy, but it's primarily using conventional therapy. And because of my practice, I see patients who want either only alternative medicine, they want only conventional medicine, or they may want both. And it's becoming more and more fashionable now and more prevalent in my population to see patients who really want both. They want the best of both worlds, and they want the full armamentarium of weaponry that we have.
And thank God.
Thank you.
One of the things that I often have not heard, and maybe it's just because I'm learning about what is out there, but how do you suggest supporting, and this is open forum, the family? That, you know, you're not treating just an individual. Often the individual has to deal with family issues, work, they have money difficulties. If they don't have insurance, there's many treatments that can't be made available. So what suggestions do you give an initial visit of an individual who's just walking in a dilemma of just in shock of even knowing that they have cancer, and how do you share with them tools for getting their life in order as they begin their journey and make their choices?
Well, absolutely. We, first of all, encourage the patient to bring everybody in. That's, you know, mom and dad and sister and brother and uncles and aunt, whoever is in the local area that can come and participate, or phone consultations to get the big picture of what's involved so that everybody understands clearly what we're trying to do, where we're going, what we feel our limitations are, and what our best idea with the circumstances are. And people people can do as much as they can do. And there's very frequently is a financial limitation, and frequently insurance companies are not going to pay for everything that you would like. And so we have to work within realistic limits, make sure that everybody's on the same page, and know that we're dealing with, you know, a very tough ballpark, and that the more things that we can impact, the more the family can help and be supportive, the more likely we are to have a better outcome. The less fear that's happening on a day-to-day basis, the more that they can plug into their spiritual life and contact their pastor or their congregation or whomever they're working with for spiritual support, and get prayer and meditation into their life to calm down, cool down, be rational. Let's look at this as a problem that needs to be dealt with, than just an instant crisis that's going to obliterate everyone and obliterate the family. We have to slow things down. We have to realize that sometimes our brethren will pronounce death sentences, and they're very unrealistic. And we've had people say, well, you have 3 months to go, and, you know, 2.5, 3 years later, we're still dealing with the patient. And it's not that it's not a struggle, it's not that it's not hard, but it really puts us in touch with our spiritual roots and our mortality instantly.
Yes.
And so everybody's best get spiritual right quickly about it, and move on, and bring the family support in as much as possible, and for the families to nurture each other and to realize that it is a huge trauma on everybody, and that as everybody can be nurturing and loving and supportive, the better it's going to be for everyone. And then to realize, you know, that the passing should be done in the highest possible spiritual way when it comes to that. And I think this is a great art, and there are many people in our community that can be very helpful with these things in helping to prepare people for the spiritual impact that it's going to be on their lives. And for that, we are deeply grateful. So meantime, we do the best work we can, and then we have great support like Dr. Forsythe, who can make the quality of life as good as possible under the most adverse circumstances. And so we have quite a kaleidoscope of responses that are available depending on the circumstance of the patient.
Yeah, I actually see a lot of people that even though a doctor may reassure them that they'll be okay, they still come to me with fear. And the thing I have to do is alleviate the fear and then get them to see it as just simply a journey, just to stay in the present moment. And I do talk to the families, I do talk to the children. And also once they know my story, all of a sudden they relax. They go, oh, okay, you made it through. Well, then I can too. But there's other things that you can introduce them to so they can do on their own, not always coming in to rely on somebody. A lot of work that Jose Silva did, which Carl Simonton picked up with the the Silva method about mind control, learning to put yourself in a type of hypnosis or trance state and begin making corrections for yourself and seeing yourself as healthy and not as diseased or not as being fearful. But if you take away the fear, then it's just day-to-day living. It's like, okay, yes, this may be a tough day, but I can do it. It's just a situation. I see the light in the tunnel type thing, instead of going, gee, there's no light at the end of the tunnel. They find it right now here. And you take away the fear, and 50% better already because they have more confidence.
Yeah, that's wonderful.
Right, and as Beth said, she was given really just a couple months to live when she was first diagnosed, and here it is 17 years later, and she's as healthy as can be and looks great. So one lesson from this is that conventional doctors are very often wrong, and giving a prognosis that's very grim like that is a big mistake on the part of conventional doctors, because really no one knows. Right. The strength of the spirit, as the title of her book, or the strength of your immune system, and all the things that are coming along. There are, after all, new developments coming over the horizon every day. Some very, very hopeful things in the area of cancer have just come along in the last several years, and we're looking forward to even more. Now, the insurance question that you touched on is a big problem also, because people like Beth are really prejudiced against because she's had a bone marrow transplant and has had cancer, she probably can't even buy an insurance policy no matter what premium
That's
she
true.
would pay per month, even if it were several thousand a month.
Wow.
Because she's had cancer and the insurance companies will not insure. We often have problems also with HMOs and these managed care organizations because they will often not allow patients who are locked into a system and who are bound into a geographical area to go outside that area for a second opinion or say for a bone marrow transplant, something that's very expensive. And when you have these executives looking at paying $150,000 for a bone marrow transplant procedure or more nowadays, they don't want to spend that money on a single patient. They're looking only at the bottom line and not at the individual patient.
Wow.
So the patient is caught in this dilemma, and the doctors who's trying to be the advocate for the patient is often caught in the middle too. So it's a very, very tough situation there with the insurance, and especially in the atmosphere we now live in under managed care.
Right. And of course, the more we can educate the public, then the public has an opportunity to make choices to either encourage their insurance agents or vote, or, you know,
Yes.
we need to take back our power, because one of the experiences, how I come to cancer is that my mother was diagnosed with breast cancer and died of liver cancer. It was probably like 9 months later. And, you know, it was an amazingly personal journey. And just to know that some of it, so many personal journeys in cancer, be it our moms or our dad or ourselves, there's so much we can do. There's so much we can do. And partly, I think it's taking back our power in ourselves and saying, this is my job to heal myself, and you are my resource. And how can I increase resources, and how can we get the information out? Because I do healing work and body work, and so I've worked with individuals with cancer and have seen miracles happen, you know, due to the grace. And that's the part that no one can factor in, is what level of grace and that person's spirit, as well as the formulation of both, you know, all aspects of medicine, you know, be it alternative or regular medicine, that
Absolutely.
there's a magic that can happen. But I have to take control of my life and allow you to empower me in my choices. And so hopefully we'll create more opportunities today.
Well, each of us are stepping stones for people.
Yes.
And whatever their choices are, we have to honor those choices and do the best we can for them in that area.
Now, I have heard of several things, and I'm just going to throw them out there, and you can. I've heard of orthomolecular nutrition, induced coma, hypothermia, antibody therapies, and these are all new therapies. Some of them, I believe, are being done in Mexico, that are some of them extreme cases, but they're having amazing results in curing or balancing cancer. This is what I've heard, and I want to know what you have heard and know about these.
Well, yes, there are many, many new therapies. I'll let Mike address orthomolecular therapy, as he's an expert in that area. There are some interesting things going on in other countries that the FDA has not yet allowed to even test in this country. One of them is induced hypoglycemic therapy, or IHT. This is a therapy that's currently being given in several areas in Mexico. It's being experimented with now in Germany. And what happens is that the cancer cell relies very heavily on carbohydrate or glucose metabolism. And it doesn't really do proteins or fats very well. So they thrive on glucose, they thrive on sugars, and that's one reason we try and avoid sugars in cancer patients. But in this type of therapy, what has happened is that the insulin is given to the patient, their blood sugar is lowered to a very low level, say between 20 and 30, and kept there for several hours, and this is done over a number of days. And by doing this, the tumor is starved of its nutrients, and the tumor cells then die off. And this has been successful. There's been some good studies done already. It's been reported in several of the alternative journals, and it looks very, very promising for even advanced cancers of many different types. Hyperthermia, another therapy that in which the body core temperature is heated between 106 and 107 degrees Fahrenheit, has been used in Germany, in Europe, and now in Mexico for a number of years with quite successful results, even in very bad cancers such as pancreatic cancer, which normally has a prognosis of less than 6 months, even treated in most cases with chemo. So these therapies look very, very promising. They're coming along, but the United States, as usual, is behind the curve in some of these more advanced therapies because the FDA tends to be overly careful and overly cautious in using these. But when you have a patient who's going to die of advanced cancer, why not try these things? Why not give the patient the option to try? Why should they have to go to Mexico or Germany and spend all that time and effort, especially when they're very ill and cachectic, and it puts a great financial burden on the family and the patient themselves. So why not give those areas a try? So we're looking at that. Mike, why don't you address the area of orthomolecular medicine?
Well, orthomolecular was a term coined by Linus Pauling in 1968. It basically means nutrition, the right molecules in the right place at the right time. And he's using, and we started out the Orthomolecular Society back in those days, and I'm past president back in '83. And I'm still very active in the organization, and we've just amended the Nevada homeopathic laws to include orthomolecular therapies and nutritional therapies, and especially nutritional intravenous's. So one of the things that's being done, and has been done for a long time, is high dosage vitamin C intravenously, 50 grams, 50,000 milligrams, 75,000 milligrams in a large IV drip, along with a lot of trace minerals and nutrients and minerals, so it's like a big multiple vitamin IV. So in and of itself, there are people who think that vitamin C in very high doses has an anti-cancer effect beyond its antioxidant effect. And that vitamin C in some of the breakdown products of vitamin C, especially in breast cancer modes and especially in experimental animals, has been shown to have an anti-tumor effect. But if you combine this high dosage vitamin C, for example, as they do in Mexico and Germany, with the hypoglycemic effect after you induce the coma, you drop the blood sugar, then you put the vitamin C in dextrose or sugar water. And so when the tumor is very low in sugar and it's really looking for sugar, then you give a blast of dextrose with the vitamin C in it. It takes the vitamin C right into the tumor and has more of a toxic effect on the tumor and can break down tumor loads according to a lot of authors. Or you can actually add a low dosage chemotherapy, which also is more effective under hyperthermia and with a high temperature, or the low blood sugar can be more protective or can be more damaging to the tumor. We've also found that especially people who do elect to do chemotherapy or radiation and take several large dosage vitamin C nutrient drips in the course of the week do much better. We had a gentleman from the Aleutian Islands who I think you have seen who had a colorectal tumor, and he took his therapy in Seattle, and they were going to shrink the tumor with radiation and chemotherapy and then do the surgery after the tumor had shrunk. Well, he did the radiation and the chemotherapy along with high dosage nutrients orally and intravenously, and he was very active. He wasn't ill during the chemotherapy. His blood counts didn't drop. He exercised through the whole thing. Nobody could believe he was doing so well. We see this quite repeatedly. And then on physical exam, the tumor was gone. And so we elected not to have the surgery to remove the tumor because it was gone. And I think we're now at somewhere over a year and a half, and with your careful observation, and he still has done very, very well. So we see this type of response fairly frequently when we do need to work in combination therapy. Certainly there are many immune system stimulants that are available, and we use things like mistletoe or viscum, which stimulates the immune system. There are many Sanum remedies, and these are a little more, they can make light fevers in the body, so the body tends to go after the cancer tumors a little more aggressively. We like to use homeopathic isodes, and homeopathic isodes, this is quite a clever thought. It's been around for a long time, where when the surgeon takes a piece of the tumor as he's doing the biopsy, and then you make a homeopathic remedy out of it, a 30x or 100x or 200x homeopathic remedy, all three of them actually, and you put them in drops of alcohol, very, very, very diluted, feed them back to the patient, and it's like an auto-vaccine against a person's own tumor, and this has been very, very helpful. Also, we've enjoyed doing a lot of the assessment of chemotherapy along with Dr. Forsythe with the Nagorny technique, where you take a little bit of the tumor and send it, and this lab in San Diego grows it in tissue culture and sees which chemotherapeutic agents or combinations of agents and or nutritional agents cause what's called apoptosis or apoptosis, which is cancer cell suicide. So you want the cancer cell to kill itself rather than just blasting it with heavy doses of radiation where it's like frying the cell. You want it to commit suicide. And so these have been some other tremendous advances in the last few years that we've been able to work with, and as well as more common ones like BCG, which is the tuberculosis vaccine, which has been used quite some time for the bladder cancer treatment to stimulate the immune system. And there are many herbal, homeopathic, and nutritional ways of stimulating the immune system. So it could go on.
Oh, that's wonderful. I can sit here and listen. It's just amazing.
Yeah, I might add to that also that in giving chemotherapy, we try and give low dose and fractionated chemo now over several days in lower dose, so it's not as toxic. Patients don't now lose their hair or become nauseous. They don't have severe lowering of their blood counts. We also have things now we can give to build up the red cells, to build up the white cells, and to prevent all those serious side effects such as severe fatigue or infections, bleeding problems. So that's all come along. And in addition to that, we have now what's called monoclonal antibodies, which means specifically directed antibodies at the cancer cells. These therapies are very non-toxic.
Yeah, that is wonderful. And I thank you all. We're going to wrap it up today. And we thank everyone for joining us. At the end of the show, there are all the ways that you may contact these individuals to further ask the questions that are personal to you or to give suggestions and support. I thank you so much, because this gives me hope that, you know, we're not only looking for ways to enhance life, but to complete life, and all of us would benefit from having more information. So thank you very much.
Thank you. Thank you.